So taking into account all of the uh, knowledge that we've become aware of, and all of the different variables, we come into a more broad approach. We take a step back. We take all of that information, we synthesize it, and we begin to assess it. And we say, okay, let's take a look at the actual healthcare systems. What are the systems that are out there now? And let's ask some fundamental questions at the broad level. So, who's responsible for public health? That's a very good question because it gets answered and different. There are different systems that would probably respond to it differently. Um, for example, social systems in Canada and the UK very much are inclined to, or based on their policy, um, suggest that government is responsible for the public's health. In the US, we're maybe conflicted. Our current policy is nor here nor there. I would say probably more leaning toward the socialized system. And I'm not suggesting yet whether that's good or bad, but the private system offers, of course, a completely different system than the socialized system, and suggests that there is more personal responsibility for the health of the individual as well as the health of the public, to providing your common man, your neighbor, and your community with respect and your services that can maybe help them with health. So, based on our current US healthcare system, it's about 70-30%. That's not an exact number, but if we take a look at the current system, we can probably say that for a very long time, we've been leaning more and more toward the social system. We've been leaning more and more toward suggesting that the responsibility of the public's health is on the hands of the government. Non-existent hands, I don't know, but but anyways, so when we're looking at Medicaid, Medicare, the ACA, which is the PPACA, the Affordable Care Act, when we're looking at the VA, Veterans, um, the Veterans Care, when we look at, I mean, I can't think of now, but welfare, right? So many different kinds of caring for the public, considering different things common goods. um, we are showing by action and by vote and by policy that our belief is that it's the responsibility of government to take care of us. And so we're going to look at the different systems and how they emerge, um, what their key, I guess. Uh, hmm. We're just going to take a look at their systems. So when we look at the goals of the social system, it's based on equality, equity, making sure that everyone is uh, has an equal result, or yeah, equal outcome, right? Here we have the Constitution. It provides both, meaning freedom and equality. On the more on the privatized, or on the libertarian, or on the more free enterprise, free market kind of system. We're looking more at not worried too much about providing equality or equity, but rather assuming that equity will emerge from the equal opportunity, right? So here we are more concerned with providing equal outcomes, making sure that everyone has access. Here we are more concerned with providing equal opportunity. Here in minimum wage, what we're talking about is, let's say everyone has in a social system, everyone is insured or guaranteed a certain amount of money. In the US, our current policy has a minimum wage. The privatized or the free enterprise or free market system would have it that there would be no minimum wage, and so that everyone would have an opportunity um, to make money. And so one of the arguments against minimum wage, for example, is that it cuts out the opportunity for low level um, potential employees. It cuts them out of a possible job because they're unable to get a job. Someone, when an employer would be able to pay them for their low level skills, and they could advance themselves through that. We cut them short because we provide a minimum wage, and no employer is willing to pay that minimum wage for a low level skill. Um, we can look at Milton Friedman, Nobel laureate economist, and Thomas Sowell, which make fairly good arguments in regards to minimum wage. And this is obviously impacting health and public health because many of the concerns that we have with regards to individual health, or when we look at people who are dispossessed or are, let's say, on the lower end of the socioeconomic status, are affected by poverty. And so we inherently can see the connection from poverty to low health outcomes. However, here the argument is, or from the economist Milton Friedman argument, is that poverty is a problem of money. It is not a problem of health. So if you want to fix health, if you want to fix ill health that is due to poverty, then you need to fix poverty, not try and make access to care free. And so the conversation is very complex, and there's much to consider. There are many consequences to each of the policies, and you really have to dig into.
Welcome back. This is Dr. Guadamus, and we're continuing on our lecture on integrative public health. And we were covering the different healthcare systems internationally, in specific Canada and UK, as opposed to US and other ideologies such as limited government, as Milton Friedman, the economist Nobel laureate, has suggested. Now, we were covering the effects of minimum wage and the different ideologies revolving around that, whether it's the socialized policies of social systems in government, or the current policy that we have here, which is kind of like a hybrid, conflicted, confused version, where we set a minimum wage, and the different approach, which would be no minimum wage for the freedom enterprise to allow for opportunity and growth of the individual. And this kind of, like I pointed out here, it seems cruel, this seems virtuous, but both have very severe impacts on the system, or on the individual through changes in the system in that kind of way. Now, in specific, we were starting to talk about direct healthcare systems that we have in place in Canada and the UK. There is the NHS. In the Canada, I forget the name that they have for their system. In the US, we have ACA, or PACA, which was the Obamacare or Affordable Care Act. And in free enterprise, we would consider that there would be no participation of the government in the healthcare system, that it would all be in the market and would be negotiated from person A to person B, or institution to person, or however, and that, well, let's go back, sorry about that, and that everything would be determined by the market. So there are some dire consequences to each of these, and here in the social aspect, that one of the major things that is being considered is the moral hazard, meaning that if it's free, if you have social care where you can get treatment anywhere, whenever you want, for whatever you want, you will go and do so as often as you can for just about whatever, and so you will burden the system, and this is this is such a prominent issue that it's an actual term that economists use and take into consideration when they're considering the impacts of certain systems. Basically, that there would be no consideration by the user if it's free or it's being paid by someone else, as opposed to, let's say, a free enterprise system or a system where there's individual responsibility and the individual has to consider the cost. And so the individual would negotiate a better price or a better fee to pay the least and not have to pay out the most, which would mean that they would try and limit their visits or use of their insurance policy or whatever it may be. In the US, or the current policy that we have here in our healthcare system, again, it's a hybrid system where you can have you can participate in the national insurance and healthcare system, or you can purchase your own. I would say that based on my experience with the ACA, my patients' experiences with the ACA, and the doctors that I interact with on a daily basis and have interacted with for some time and communicate with, in large part has been that it is largely more of a burden and ineffective, and has dire consequences, although it provides some substantial benefits to people in the lower socioeconomic status, in that it provides them access to care, to have specific treatments given, and without them having to worry or being stressed about being able to pay it, because it's guaranteed to be paid by this system. Now, the caution that we have in this system, or rather, the benefit there that is produced from this system, is said by the free enterprise ideology that the lower socioeconomic status individual would have access to that care if there were actual free enterprise that were unfettered by the government, because there would be competition, and competition would lower the cost. Let's move on. Here we have a single payer method, meaning that only the government is paying or is in charge of public health. In the US, we have a hybrid system. Again, we have the ACA, but you can also get private insurance. And in limited government, or in the free enterprise system, there would be no government interaction, and so everything would be negotiated, whether it be that there's no insurance, or that even the insurance rates would be negotiated. Now, there is a lot to be said within this conversation, and it's a lot to do with the economic policy and monetary policy, especially when we start getting into this lower section here with welfare and patient protection, because it guarantees certain things that burden the system bureaucratically and also economically. And we've already talked about how all of these different variables directly impact public health, but how poverty and lower socioeconomic status and being dispossessed in the system is not it's a money problem. It is not a health problem, meaning that the problem of the individual not having access to healthcare is not a healthcare problem. It is a money problem. And so the way to resolve that is through providing an opportunity for the individual to negotiate better fees and to grow their income, or grow their capital, or grow their ability to make money, and raise their economic status. And that conversation is being had and debated all over the place. So here we have in the social system a high tax rate, which it has to be so in order to pay for all of the common goods and social systems that are going to be provided. In the US, the current policy, we have such things as welfare. We provide certain housing, and WIC, for example, where we provide food and things of that nature. And Milton Friedman once proposed a negative income tax to ensure that there's some safety net for the dispossessed and the disenfranchised, because they recognize that the free enterprise and the free market will have some market failures. There will be externalities, and there will be things that will have to be controlled, and some policies will have to come in to have some limited government control for these market failures. And so one of them was introduced as the negative income tax, where should a person not make any money at all, they would still be provided a basic income, but that basic income would be so minimal that no one would, let's say, be able to suggest that they were just not going to work, because people would still want to thrive. I'm not certain how, I don't know the research behind this. It just, Milton Friedman described it and was exploring it. But the welfare system is certainly burdening the taxpayer, and at the level of social systems, it's near unsustainable, provided by historical context. And yeah, we'll just move on from there. But there's much to be said along the economic policies, and they are directed to, again, public health is a complex adaptive system, and economic policy and monetary policy are things that we have to consider in terms of what the impacts are and how they directly impact public health. So, for example, one of the things that's mentioned is the creation of the Federal Reserve in 1913, was it? Directly, and I think the Federal Reserve, one of the Federal Reserve presidents, acknowledged that they were very much the reason for the crash in 1929. And by the way, you have to know a little bit about the history of the Federal Reserve, but it's a monetary policy that took the hands off of government from coining currency, which was constitutional power that I believe Congress had, and it was given to a private. It's a hybrid sector, like it's privatized, but it's not quite privatized. It's kind of confusing there. But anyways, because of the crash, Medicaid, Medicare were instituted, or something like that. And since then, we've had Medicaid, Medicare, have been off of the gold standard and have had runaway debt. And so inflation and all of these things have been impacting individuals and pretty much provided more and more negative consequences toward lower socioeconomic status individuals. Now, one of the big things to note here is that the Medicaid and Medicare services, again, are overburdened, and the administrative costs or the cost of these services and these public goods have outburdened the system, how they were structured, and so they've gone into different sources of income, so they go directly into the taxpayer as opposed to how it was funded previously. One of the other things to point out here is that during that time, one of the presidents, I forget who, instituted a law where to try and balance healthcare and to try to incentivize employment, because employers needed to employ people. To create an incentive, they tax exempted insurance for employers. So your employer was able to offer, the companies were able to offer the individuals insurance as an incentive, and the company would be able to provide it tax free. And so, whereas the individual had to pay taxes on it. And so obviously that shifted the way that the market negotiated health insurance, and there's been substantial um, we'll say negative consequences due to that.